So here's the second patient that we're looking at. She was somebody that came into me and she was very concerned about her appearance.
Okay.
So you can see from this photo that she's missing a lot of her teeth down below. And she worked in a very high profile profession where she had to deal with people face to face and talk to them all the time. And she just felt like she could not communicate or be her best self and be able to get the results that she wanted with the limited amount of teeth that she had down below. And you'll see on this patient too that you know, as we get a little bit older, all you do is you focus on the lower teeth because our lips will come down and it will expose more of our lower teeth. The good thing
So she was very self-conscious.
She was very self-conscious, absolutely. And the good thing, let me show you her after photo.
Okay.
Just so beautiful. You know what stands out to me is she wore,
nice.
like, look at how she dolled herself up for this after photo, this last appointment. She's doing her hair, she has her makeup done. You can see in her eyes how much more vibrant she feels about her life. And when you look at this picture of her, you actually cannot tell that she has had any work done. You can't tell that she was missing all her original teeth.
So her option would have been a denture, like a lower denture.
Yeah, when she came to us, she was in a partial denture, and there was damage to these 4 front teeth that were remaining, and she was bound to get a lower denture. And Randy, I never recommend that anybody just get simply a denture down below, especially.
Okay.
I always recommend that they get implants because it's so hard to have a denture down below where you have this big tongue.
Okay.
You don't have a lot of bone for support. A lower denture does not work.
Do you ever get excited? Like, for example, I know that, look, they're telling you their hard luck story with their bad teeth, and they've determined that they're going to move forward. But do you ever get, like, excited, like you see the end result, like thinking, I think we talked about in this green room, like they don't even know how good it's going to be. Is that right?
Yeah, absolutely. Yeah, and this is a great example. Like you know, people will come in and I know they're signing up for something, but they don't truly know the transformation that's going to happen, right?
It's big.
When you're looking at her, she didn't know that she was going to, you know, look like she was 10 years younger.
Okay.
She didn't know that it was going to give her the confidence to get ready for the day. So these things all just make everything so much better.
And you just brush them and get your checkups just like regular teeth?
Right. So you can brush them if you want to. You don't have to brush them. We do give you a water pick because we do want you to clean.
Is that right? They don't stain?
They don't stain.
So you could do just a water pick?
Right. Correct. Yep.
That's
just
nice.
a water pick. So
Never heard that before.
Your new toothbrush is a water pick, right?
That's
and
nice.
we want you to do that a couple times a day. We just don't want the really small debris from eating food to be trapped under anything.
Okay.
We want everything to stay healthy. Use salt water, things like that.
Okay.
But yeah, you don't have to brush them. Your life's completely different. The material's made out of something that's not going to decay. It's made out of something that's not going to break. This is a huge solution for people that all they've been experiencing their whole life is teeth that when they get fixed end up breaking shortly thereafter.